Hello, nursing students. Welcome to Nursing Exam Preparation, your trusted resource for excelling in nursing exams with confidence. In today's video, we'll walk you through 150 multiple-choice questions, MCQs, on Alzheimer's disease, each crafted to challenge your understanding and deepen your knowledge of this critical topic. With detailed explanations provided for every question, you'll not only learn the correct answers, but also understand the reasoning behind them. Whether you're starting your studies or reviewing for exams, this video is packed with content designed to test your skills, sharpen your critical thinking, and reinforce key concepts related to Alzheimer's disease. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more valuable resources. Be sure to hit the bell icon to stay updated on our latest videos, all aimed at helping you succeed. Once you've finished the video, let us know how you did by sharing your score in the comments below. We'd love to hear from you. Let's get started and work together toward mastering Alzheimer's disease and achieving exam success. 1. Which of the following is the hallmark pathophysiological feature of Alzheimer's disease? A. Lewy bodies in the brain. B. Amyloid plaques and tau tangles. C. Neurofibrillary tangles only. D. Cerebral infarction. Answer: B. Amyloid plaques and tau tangles. Rationale: amyloid plaques and tau tangles are the hallmark features of Alzheimer's disease and disrupt normal neuronal function. 2. Which clinical symptom is typically the earliest sign of Alzheimer's disease? A. Memory loss. B. Personality changes. C. Hallucinations. D. Impaired motor coordination. Answer: A. Memory loss. Rationale: short-term memory loss is often one of the first symptoms in Alzheimer's disease, typically observed in early stages. 3. Which diagnostic test is commonly used to assess for amyloid plaques in the brain of patients suspected of having Alzheimer's disease? A. MRI. B. CT scan. C. PET scan with amyloid imaging. D. Electroencephalogram, EEG. Answer: C. PET scan with amyloid imaging. Rationale: PET scans with amyloid imaging are used to detect amyloid plaques, a key feature of Alzheimer's disease. 4. A patient with Alzheimer's disease is becoming increasingly agitated during routine daily care. Which intervention is most appropriate to reduce agitation? A. Provide frequent orientation cues. B. Use physical restraints. C. Encourage the patient to perform complex tasks. D. Change the patient's routine frequently. Answer: A. Provide frequent orientation cues. Rationale: frequent orientation cues can reduce confusion and anxiety, helping to decrease agitation in Alzheimer's patients. 5. Which of the following medications is commonly prescribed to slow the progression of symptoms in Alzheimer's disease? A. Lithium. B. Donepezil. C. Olanzapine. D. Haloperidol. Answer: B. Donepezil. Rationale: donepezil is a cholinesterase inhibitor that helps slow cognitive decline by increasing acetylcholine levels in the brain. 6. What is the primary goal of non-pharmacological interventions in Alzheimer's disease? A. Cure the disease. B. Slow cognitive decline. C. Provide emotional support. D. Relieve symptoms and improve quality of life. Answer: D. Relieve symptoms and improve quality of life. Rationale: non-pharmacological interventions focus on improving quality of life and addressing behavioral symptoms in Alzheimer's patients. 7. A 70-year-old patient with Alzheimer's disease is living at home with a caregiver. Which of the following would be the most appropriate safety precaution? A. Allow the patient to drive with supervision. B. Install locks on doors and windows. C. Encourage the patient to take long walks alone. D. Remove all mirrors from the home. Answer: B. Install locks on doors and windows. Rationale: installing locks helps prevent wandering, a common concern in Alzheimer's patients. 8. Which of the following is the most common behavioral symptom seen in the early stages of Alzheimer's disease? A. Delusions. B. Depression. C. Hallucinations. D. Agitation. Answer: B. Depression. Rationale: Depression is common in the early stages of Alzheimer's, often due to the awareness of cognitive decline. 9. Which of the following is a key difference between Alzheimer's disease and vascular dementia? A. Vascular dementia is caused by amyloid plaques. B. Alzheimer's disease is associated with cerebrovascular events. C. Vascular dementia is characterized by a stepwise decline in function. D. Alzheimer's disease progresses more rapidly than vascular dementia. Answer: C. Vascular dementia is characterized by a stepwise decline in function. Rationale: vascular dementia typically follows a stepwise decline in cognitive function due to cerebrovascular events, unlike Alzheimer's, which generally has a more gradual progression. 10. Which of the following cognitive changes is most likely to occur in the later stages of Alzheimer's disease? A. Mild short-term memory loss. B. Disorientation to time and place. C. Improved verbal communication. D. Increased ability to perform ADLs. Answer: B. Disorientation to time and place. Rationale: in the later stages of Alzheimer's disease, patients commonly experience significant disorientation to time and place. 11. A patient with Alzheimer's disease is exhibiting frequent wandering behaviors. Which intervention is most appropriate to ensure patient safety? A. Use physical restraints. B. Keep doors locked and provide supervision. C. Allow the patient to walk freely. D. Limit fluid intake. Answer: B. Keep doors locked and provide supervision. Rationale: keeping doors locked and providing supervision ensures the patient's safety while reducing the risk of wandering, which is common in Alzheimer's disease. 12. A common complication in the later stages of Alzheimer's disease is A. Seizures. B. Dysphagia, difficulty swallowing. C. Hypotension. D. Urinary incontinence. Answer: B. Dysphagia, difficulty swallowing. Rationale: dysphagia becomes a significant issue in the later stages of Alzheimer's disease, leading to an increased risk of aspiration and malnutrition. 13. Which of the following is a first-line medication used in the treatment of Alzheimer's disease? A. Donepezil. B. Lorazepam. C. Clonazepam. D. Gabapentin. Answer: A. Donepezil. Rationale: donepezil is a cholinesterase inhibitor that is used to slow cognitive decline in Alzheimer's disease by increasing acetylcholine levels. 14. Which of the following should be included in a care plan for an Alzheimer's patient who is in the moderate stage of the disease? A. Encourage long periods of solitude. B. Provide consistent daily routines. C. Increase physical activity. D. Limit family interaction. Answer: B. Provide consistent daily routines. Rationale: providing consistent routines helps reduce confusion and anxiety in moderate-stage Alzheimer's patients by offering structure and predictability. 15. A patient in the early stage of Alzheimer's disease becomes upset when they can no longer remember the names of their family members. What is the best intervention? A. Ignore the patient's anxiety. B. Reassure the patient and use memory aids. C. Allow the patient to withdraw. D. Criticize the patient for forgetting. Answer: B. Reassure the patient and use memory aids. Rationale: reassuring the patient and using memory aids such as photo albums or name tags can help alleviate anxiety and support memory recall. 16. A common behavioral issue in Alzheimer's patients that is often managed with medication is A. Hyperactivity. B. Aggression. C. Amnesia. D. Hypersomnia. Answer: B. Aggression. Rationale: aggression is common in Alzheimer's patients and is often managed with antipsychotic medications and non-pharmacological interventions. 17. When educating family members about Alzheimer's disease, the nurse should explain that the disease is A. Reversible with medication. B. Always diagnosed in childhood. C. A progressive neurodegenerative disease. D. Only inherited from the mother. Answer: C. A progressive neurodegenerative disease. Rationale: Alzheimer's disease is a progressive neurodegenerative disease that results in gradual cognitive decline and cannot be reversed with current treatments. 18. Which of the following changes in the brain is most closely associated with Alzheimer's disease? A. Decreased dopamine levels. B. Increased serotonin production. C. Accumulation of beta-amyloid plaques. D. Enlarged ventricles only. Answer. C. Accumulation of beta-amyloid plaques. Rationale. The accumulation of beta-amyloid plaques in the brain is one of the defining characteristics of Alzheimer's disease, leading to neuronal damage. 19. In the later stages of Alzheimer's disease, which of the following interventions would most likely promote patient comfort? A. Use of mechanical restraints. B. Environmental modifications to reduce stimulation. C. Increased social interaction. D. Provide complex mental tasks. Answer. B. Environmental modifications to reduce stimulation. Rationale. In later stages, reducing environmental stimuli helps reduce confusion, anxiety, and aggression in Alzheimer's patients. 20. Which of the following is a typical manifestation of Alzheimer's disease in its early stages? A. Loss of appetite. B. Difficulty in recognizing familiar faces. C. Short-term memory loss. D. Severe muscle weakness. Answer. C. Short-term memory loss. Rationale. Short-term memory loss is one of the earliest and most common signs of Alzheimer's disease, often noticed as the inability to remember recent events. 21. A patient with Alzheimer's disease begins to exhibit impulsive behavior and sexually inappropriate actions. Which approach would be most effective? A. Ignore the behavior to avoid confrontation. B. Redirect the patient's attention to another activity. C. Confront the patient about the behavior. D. Give the patient sedatives to calm them down. Answer. B. Redirect the patient's attention to another activity. Rationale. Redirecting attention to a different activity helps to minimize impulsive and inappropriate behaviors without escalating the situation. 22. A patient with Alzheimer's disease has difficulty recognizing their caregiver. Which approach is most helpful for the nurse to use? A. Remind the patient repeatedly who the caregiver is. B. Use visual cues like family photos to help recognition. C. Avoid confrontation and leave the patient alone. D. Introduce the caregiver by name every time. Answer. B. Use visual cues like family photos to help recognition. Rationale. Visual cues, such as photos, are helpful in facilitating recognition and reducing the confusion associated with Alzheimer's disease. 23. Which of the following is an example of a non-pharmacological intervention that could help manage behavioral symptoms in Alzheimer's patients? A. Meditation and relaxation techniques. B. Increased antipsychotic medication. C. High-dose vitamin E supplementation. D. Cognitive behavioral therapy. Answer. A. Meditation and relaxation techniques. Rationale. Meditation and relaxation techniques can help reduce stress, anxiety, and agitation in Alzheimer's patients. 24. What is the main purpose of using cholinesterase inhibitors in Alzheimer's disease? A. To reverse the disease process. B. To increase acetylcholine levels in the brain. C. To cure cognitive decline. D. To reduce beta-amyloid plaques. Answer. B. To increase acetylcholine levels in the brain. Rationale. Cholinesterase inhibitors increase acetylcholine, which helps improve cognitive function and manage symptoms in Alzheimer's disease. 25. Which of the following can be an early indicator of Alzheimer's disease? A. Forgetting the names of family members. B. Becoming disoriented to time and place. C. Inability to recognize familiar objects. D. Severe personality changes. Answer. A. Forgetting the names of family members. Rationale. Difficulty recalling names, including those of family members, is an early sign of Alzheimer's disease, commonly affecting short-term memory. 26. A 75-year-old patient with Alzheimer's disease is refusing to take their medication. Which of the following strategies is most effective? A. Force the patient to take the medication. B. Offer the medication with food or drink. C. Yell at the patient for refusing. D. Ignore the refusal and try later. Answer. B. Offer the medication with food or drink. Rationale. Offering medication with food or drink may increase the likelihood of compliance, especially in patients who have difficulty swallowing pills. 27. A patient with Alzheimer's disease is becoming frustrated and agitated when trying to perform a task. What is the best intervention for the nurse to use? A. Encourage the patient to complete the task independently. B. Provide physical assistance as needed, but give praise for effort. C. Tell the patient they need to try harder. D. Ignore the behavior and walk away. Answer. B. Provide physical assistance as needed, but give praise for effort. Rationale. Providing assistance while offering positive reinforcement helps reduce frustration and maintain the patient's dignity. 28. Which of the following is the most appropriate nursing action when managing a patient with Alzheimer's disease and symptoms of depression? A. Administer antidepressants without further evaluation. B. Provide emotional support and involve the patient in social activities. C. Ignore the symptoms as they are part of the disease. D. Tell the patient to snap out of it. Answer. B. Provide emotional support and involve the patient in social activities. Rationale. Providing emotional support and encouraging social interaction helps address symptoms of depression and improve the patient's overall well-being. 29. A patient in the middle stage of Alzheimer's disease is at risk for falls. Which of the following interventions would be most effective in preventing falls? A. Use a sedative to keep the patient calm. B. Install grab bars and remove tripping hazards. C. Allow the patient to move freely without supervision. D. Limit physical activity to reduce fatigue. Answer. B. Install grab bars and remove tripping hazards. Rationale. Installing grab bars and removing tripping hazards help create a safer environment for Alzheimer's patients, reducing the risk of falls. 30. Which of the following is a key factor in distinguishing Alzheimer's disease from other types of dementia? A. The presence of amyloid plaques. B. Early onset of severe motor symptoms. C. The sudden onset of cognitive symptoms. D. Complete loss of motor control. Answer. A. The presence of amyloid plaques. Rationale. Amyloid plaques are a key pathological feature of Alzheimer's disease, distinguishing it from other types of dementia. 31. Which of the following is a typical early symptom of Alzheimer's disease that affects the patient's ability to perform daily activities? A. Short-term memory loss. B. Severe motor deficits. C. Sudden incontinence. D. Sudden hallucinations. Answer. A. Short-term memory loss. Rationale. Short-term memory loss is one of the earliest and most prominent symptoms of Alzheimer's disease, often affecting the ability to retain new information. 32. A patient diagnosed with Alzheimer's disease is being discharged from the hospital. Which of the following is a priority consideration for the discharge plan? A. Instruct family to monitor for signs of infection. B. Develop a structured daily routine. C. Encourage the patient to drive independently. D. Advise family to limit social interaction. Answer. B. Develop a structured daily routine. Rationale. Establishing a consistent routine helps reduce confusion and anxiety in Alzheimer's patients and can improve their overall quality of life. 33. A nurse is caring for a patient with Alzheimer's disease who is exhibiting aggression. Which approach should the nurse use first? A. Provide a quiet, calm environment. B. Administer antipsychotic medications. C. Engage in physical activity. D. Isolate the patient from others. Answer. A. Provide a quiet, calm environment. Rationale. A calm environment can help reduce aggression in Alzheimer's patients by minimizing external stimuli and creating a sense of security. 34. Which of the following behaviors is most commonly associated with the late stages of Alzheimer's disease? A. Inability to recognize familiar faces. B. Short-term memory loss. C. Difficulty recognizing objects. D. Sudden changes in personality. Answer. A. Inability to recognize familiar faces. Rationale. In the later stages of Alzheimer's disease, patients often lose the ability to recognize familiar faces, including family members. 35. Which of the following is the primary role of acetylcholinesterase inhibitors in Alzheimer's disease? A. To increase serotonin levels in the brain. B. To block the formation of amyloid plaques. C. To improve cognitive function by increasing acetylcholine levels. D. To reduce beta-amyloid plaques. Answer. C. To improve cognitive function by increasing acetylcholine levels. Rationale: acetylcholinesterase inhibitors, such as donepezil, increase acetylcholine levels in the brain, which helps improve cognitive function in Alzheimer's patients. 36. Which type of cognitive impairment is most common in patients with Alzheimer's disease? A. Impaired executive function. B. Impaired short-term memory. C. Impaired motor skills. D. Impaired long-term memory. Answer: B. Impaired short-term memory. Rationale: short-term memory loss is one of the earliest and most prevalent cognitive impairments in Alzheimer's disease. 37. What is a common non-pharmacological intervention to help manage sleep disturbances in patients with Alzheimer's disease? A. Use of bright light therapy during the day. B. Encourage daytime napping. C. Provide heavy meals before bedtime. D. Keep the patient isolated at night. Answer: A. Use of bright light therapy during the day. Rationale: bright light therapy helps regulate circadian rhythms and can improve sleep patterns in Alzheimer's patients. 38. A nurse is teaching the family of a patient with Alzheimer's disease about communication techniques. Which of the following is the best approach? A. Speak loudly and use simple words. B. Avoid speaking to the patient at all. C. Use open-ended questions frequently. D. Speak slowly, use clear, simple language, and give the patient time to respond. Answer: D. Speak slowly, use clear, simple language, and give the patient time to respond. Rationale: using clear, simple language and allowing the patient time to respond helps reduce confusion and frustration for patients with Alzheimer's disease. 39. A patient with Alzheimer's disease is becoming increasingly confused about the time of day. Which of the following is the best intervention to help the patient? A. Limit exposure to natural light. B. Keep the room dark and quiet at night. C. Use clocks and calendars as reminders. D. Encourage daytime sleeping. Answer: C. Use clocks and calendars as reminders. Rationale: clocks and calendars are helpful reminders that can reduce confusion about time for Alzheimer's patients. 40. Which of the following is most likely to cause a worsening of cognitive symptoms in a patient with Alzheimer's disease? A. Overstimulation from too much noise. B. Regular physical exercise. C. Proper nutrition and hydration. D. Structured daily routines. Answer: A. Overstimulation from too much noise. Rationale: overstimulation from noise or excessive activity can worsen cognitive symptoms and cause agitation in Alzheimer's patients. 41. What is the primary purpose of using antidepressants in patients with Alzheimer's disease? A. To treat the cognitive symptoms of Alzheimer's. B. To prevent aggression. C. To manage symptoms of depression, which are common in Alzheimer's. D. To improve memory. Answer: C. To manage symptoms of depression, which are common in Alzheimer's. Rationale: depression is common in Alzheimer's patients, and antidepressants help manage this symptom to improve overall well-being. 42. Which of the following is a common side effect of cholinesterase inhibitors used in the treatment of Alzheimer's disease? A. Hypertension. B. Diarrhea. C. Bradycardia. D. Weight loss. Answer: C. Bradycardia. Rationale: cholinesterase inhibitors can cause bradycardia due to the increase in acetylcholine levels, which can affect heart rate. 43. What is the primary clinical manifestation of Alzheimer's disease in the early stage? A. Difficulty with short-term memory. B. Loss of physical coordination. C. Delusions and hallucinations. D. Severe personality changes. Answer: A. Difficulty with short-term memory. Rationale: difficulty with short-term memory is the hallmark symptom of early-stage Alzheimer's disease, often leading to forgetfulness and confusion. 44. A nurse is preparing to assist with a cognitive assessment for a patient with suspected Alzheimer's disease. Which of the following is most commonly used? A. Mini Mental State Examination, MMSE. B. Glasgow Coma Scale. C. The Geriatric Depression Scale. D. The Beck Depression Inventory. Answer: A. Mini Mental State Examination, MMSE. Rationale: The Mini Mental State Examination, MMSE, is commonly used to assess cognitive function and diagnose Alzheimer's disease. 45. In Alzheimer's disease, which neurotransmitter is most often implicated in cognitive decline? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Norepinephrine. Answer: C. Acetylcholine. Rationale: acetylcholine plays a critical role in memory and learning, and its depletion is associated with cognitive decline in Alzheimer's disease. 46. A patient in the early stage of Alzheimer's disease asks the nurse if there is a cure. What is the best response? A. There is no cure, but we can cure the symptoms. B. There is no cure, but we have treatments that may slow progression. C. We will find a cure in the future. D. There is no cure and treatment options are limited. Answer: B. There is no cure, but we have treatments that may slow progression. Rationale: the nurse should provide an honest yet hopeful response, explaining that while there is no cure for Alzheimer's, treatments are available to manage symptoms and slow progression. 47. Which of the following is a common safety concern for caregivers of patients with Alzheimer's disease? A. Dehydration. B. Medication overdose. C. Caregiver burnout and stress. D. Malnutrition. Answer: C. Caregiver burnout and stress. Rationale: caregiver burnout is a significant concern for those caring for Alzheimer's patients due to the emotional and physical demands of care. 48. Which of the following best describes the progression of Alzheimer's disease? A. It progresses in a linear fashion. B. It progresses in stages, with gradual decline. C. It progresses rapidly over months. D. It worsens only during the night. Answer: B. It progresses in stages, with gradual decline. Rationale: Alzheimer's disease typically progresses slowly and in stages, with gradual decline in cognitive and functional abilities. 49. A patient with Alzheimer's disease exhibits repetitive questioning. The nurse should: A. Respond with the same information every time. B. Provide a detailed answer each time. C. Ignore the patient and move on to another activity. D. Tell the patient they already asked the question. Answer: A. Respond with the same information every time. Rationale: repetitive questioning is common in Alzheimer's patients due to memory loss, and the nurse should answer with patience and consistency. 50. A nurse is assessing a patient with Alzheimer's disease who is exhibiting disorientation to time. Which intervention is most appropriate? A. Provide the patient with a wristwatch and calendar. B. Tell the patient that it is not important. C. Correct the patient's mistakes every time. D. Allow the patient to stay confused. Answer: A. Provide the patient with a wristwatch and calendar. Rationale: providing a wristwatch and calendar can help the patient stay oriented to time and reduce confusion in Alzheimer's patients. 51. Which of the following is a key feature of Alzheimer's disease that differentiates it from other forms of dementia? A. Sudden onset of symptoms. B. Presence of beta-amyloid plaques in the brain. C. Rapid progression of symptoms. D. Increased levels of dopamine. Answer: B. Presence of beta-amyloid plaques in the brain. Rationale: the accumulation of beta-amyloid plaques is a hallmark feature of Alzheimer's disease and helps differentiate it from other dementias. 52. A patient with Alzheimer's disease demonstrates apraxia, difficulty with purposeful movement. Which of the following actions would be most helpful? A. Encourage the patient to move faster. B. Break tasks into smaller steps and offer assistance. C. Allow the patient to complete tasks independently. D. Provide a detailed explanation of each task. Answer: B. Break tasks into smaller steps and offer assistance. Rationale: breaking tasks into smaller, manageable steps and offering assistance helps patients with Alzheimer's disease overcome apraxia and perform daily activities. 53. Which of the following cognitive functions is most affected by Alzheimer's disease in its early stages? A. Language skills. B. Attention span. C. Long-term memory. D. Short-term memory. Answer: D. Short-term memory. Rationale: In the early stages of Alzheimer's disease, short-term memory is most significantly affected, leading to difficulties in retaining recent information. 54. A family member of a patient with Alzheimer's disease asks about potential side effects of donepezil. What is the most common side effect of this medication? A. Weight gain. B. Increased salivation. C. Diarrhea. D. Insomnia. Answer: C. Diarrhea. Rationale: diarrhea is a common side effect of donepezil, a cholinesterase inhibitor used in the treatment of Alzheimer's disease. 55. Which of the following behaviors is most likely to occur in the moderate stage of Alzheimer's disease? A. Disorientation to time and place. B. Complete inability to recognize family members. C. Complete inability to speak. D. Agitation and wandering. Answer: D. Agitation and wandering. Rationale: in the moderate stage, agitation and wandering behaviors are common as patients become more disoriented and confused. 56. A patient with Alzheimer's disease is experiencing significant memory loss. Which of the following interventions would be most effective in helping the patient recall information? A. Remind the patient constantly of past events. B. Use memory aids such as photos or labels. C. Avoid any discussion of past events. D. Limit social interaction. Answer: B. Use memory aids such as photos or labels. Rationale: memory aids like photos or labels can help Alzheimer's patients recall familiar faces and objects, enhancing recognition and reducing confusion. 57. Which of the following factors can increase the risk of developing Alzheimer's disease? A. A family history of Alzheimer's disease. B. High levels of physical activity. C. A diet high in antioxidants. D. A history of mental illness. Answer: A. A family history of Alzheimer's disease. Rationale: a family history of Alzheimer's disease is a known risk factor for developing the condition, as genetic factors play a significant role in its onset. 58. What is the primary purpose of using a cognitive screening test, e.g., mini mental state examination, in Alzheimer's patients? A. To diagnose Alzheimer's disease. B. To determine the patient's level of pain. C. To measure the patient's overall health. D. To assess the degree of cognitive impairment. Answer: D. To assess the degree of cognitive impairment. Rationale: cognitive screening tests, such as the MMSE, are used to assess the extent of cognitive impairment and monitor changes in cognitive function over time. 59. Which of the following is a common non-pharmacological intervention to improve quality of life in Alzheimer's patients? A. Strict time limits on social interactions. B. Cognitive behavioral therapy. C. Structured routines and familiar environments. D. Encourage the patient to focus on new tasks. Answer: C. Structured routines and familiar environments. Rationale: structured routines and familiar environments help reduce confusion and anxiety, promoting a sense of security for Alzheimer's patients. 60. A patient in the early stage of Alzheimer's disease asks the nurse if they can continue driving. What is the nurse's most appropriate response? A. You may continue driving as long as you feel comfortable. B. It is unsafe to drive due to your condition. C. We will need to assess your ability to drive. D. It is illegal for people with Alzheimer's to drive. Answer: C. We will need to assess your ability to drive. Rationale: driving ability should be assessed on an individual basis, as cognitive decline may affect a patient's ability to drive safely. 61. Which of the following is an example of a behavioral symptom that can occur in Alzheimer's disease? A. Difficulty recognizing familiar faces. B. Impaired executive function. C. Wandering or pacing. D. Severe memory loss. Answer: C. Wandering or pacing. Rationale: wandering and pacing are common behavioral symptoms in Alzheimer's disease, often due to disorientation and restlessness. 62. A patient with Alzheimer's disease is exhibiting signs of depression. Which of the following would be the nurse's priority action? A. Start antidepressant medication immediately. B. Assess for suicide risk and provide appropriate interventions. C. Ignore the symptoms and focus on cognitive function. D. Tell the patient to snap out of it. Answer: B. Assess for suicide risk and provide appropriate interventions. Rationale: depression in Alzheimer's patients should be assessed for suicide risk, as the patient may not have the capacity to seek help or express their feelings. 63. The nurse is caring for an Alzheimer's patient who has begun to hoard food. Which intervention would be most appropriate? A. Ignore the behavior to avoid confrontation. B. Provide structured meals and snacks to minimize anxiety. C. Scold the patient for hoarding food. D. Limit food intake to prevent further hoarding. Answer: B. Provide structured meals and snacks to minimize anxiety. Rationale: hoarding food can be an anxiety-driven behavior in Alzheimer's patients. Providing structured meals and snacks helps reduce anxiety and prevent this behavior. 64. Which of the following is a primary goal of drug therapy in Alzheimer's disease? A. To cure Alzheimer's disease. B. To stop the progression of the disease. C. To reduce the severity of symptoms and slow disease progression. D. To reverse the cognitive decline. Answer: C. To reduce the severity of symptoms and slow disease progression. Rationale: drug therapy in Alzheimer's aims to alleviate symptoms and slow the progression of cognitive decline, but it does not cure the disease. 65. A patient with Alzheimer's disease is experiencing sundowning, which includes increased agitation and confusion in the late afternoon and evening. Which intervention is most helpful? A. Encourage exercise in the evening. B. Provide a calm and quiet environment with soft lighting. C. Offer large meals during the evening. D. Allow the patient to stay awake as long as possible. Answer: B. Provide a calm and quiet environment with soft lighting. Rationale: providing a calm, quiet environment with soft lighting can help reduce the symptoms of sundowning, which are often triggered by overstimulation. 66. The nurse is teaching a family member about Alzheimer's disease. Which statement by the family member indicates that further teaching is needed? A. I understand that Alzheimer's disease is progressive and irreversible. B. I should encourage my loved one to maintain independence for as long as possible. C. My loved one's symptoms will go away with medication. D. I will need to create a routine to help my loved one feel secure. Answer: C. My loved one's symptoms will go away with medication. Rationale: Alzheimer's disease is a progressive and irreversible condition, and symptoms will not go away with medication, although medications can help manage symptoms. 67. In the later stages of Alzheimer's disease, which of the following is a priority nursing intervention? A. Encourage the patient to participate in complex tasks. B. Ensure proper nutrition and hydration. C. Maximize the patient's independence. D. Encourage daily outdoor activities. Answer: B. Ensure proper nutrition and hydration. Rationale: in the later stages of Alzheimer's, patients often have difficulty eating and drinking, so ensuring adequate nutrition and hydration is a priority. 68. Which of the following is the most appropriate nursing intervention when caring for a patient with Alzheimer's disease who is exhibiting paranoia? A. Reassure the patient and avoid confrontation. B. Encourage the patient to discuss their fears. C. Ignore the paranoid behaviors. D. Tell the patient that their fears are irrational. Answer: A. Reassure the patient and avoid confrontation. Rationale: reassuring the patient without confrontation can help reduce anxiety and paranoia, as Alzheimer's patients may not be able to differentiate reality from their delusions. 69. A nurse is caring for a patient with Alzheimer's disease who has become incontinent. Which of the following actions would be most effective in managing this problem? A. Use physical restraints to prevent accidents. B. Encourage the patient to use the bathroom at regular intervals. C. Ignore the incontinence as it is expected. D. Limit the patient's fluid intake. Answer: B. Encourage the patient to use the bathroom at regular intervals. Rationale: encouraging the patient to use the bathroom at scheduled times helps manage incontinence, as Alzheimer's patients often forget to use the bathroom on their own. 70. The family of a patient with Alzheimer's disease asks about genetic testing. Which of the following is most accurate regarding genetic testing for Alzheimer's? A. It is a routine part of the diagnostic process. B. It can predict the exact onset of Alzheimer's disease. C. Genetic testing is not typically used for diagnosing Alzheimer's. D. It is only recommended for individuals with late-onset Alzheimer's. Answer: C. Genetic testing is not typically used for diagnosing Alzheimer's. Rationale: while genetic testing may be used in research or for early-onset Alzheimer's, it is not typically used for diagnosing the disease in clinical practice. 71. Which of the following is the primary role of a caregiver for a patient with Alzheimer's disease? A. To ensure the patient takes all medications on time. B. To monitor and guide the patient's daily routines and activities. C. To make all decisions for the patient, including financial decisions. D. To prevent the patient from ever leaving the house. Answer: B. To monitor and guide the patient's daily routines and activities. Rationale: the caregiver's primary role is to help the patient with daily routines and activities, providing support while allowing as much independence as possible. 72. A patient with Alzheimer's disease becomes agitated during personal care. Which of the following interventions is most appropriate? A. Restrain the patient to prevent injury. B. Offer reassurance and proceed with care slowly. C. Tell the patient they must comply. D. Discontinue personal care and attempt it later. Answer: B. Offer reassurance and proceed with care slowly. Rationale: offering reassurance and proceeding slowly helps reduce anxiety and agitation, which are common in Alzheimer's patients during personal care. 73. Which of the following nursing interventions would best help prevent wandering behavior in a patient with Alzheimer's disease? A. Use physical restraints to limit movement. B. Install door alarms and use secured areas. C. Allow the patient to roam freely in the house. D. Encourage the patient to walk outside frequently. Answer: B. Install door alarms and use secured areas. Rationale: installing door alarms and securing areas helps prevent wandering while ensuring the patient's safety. 74. What is the primary reason that acetylcholinesterase inhibitors are prescribed to patients with Alzheimer's disease? A. To reduce the formation of amyloid plaques. B. To increase acetylcholine levels in the brain and improve cognitive function. C. To decrease dopamine levels in the brain. D. To prevent the progression of Alzheimer's disease. Answer: B. To increase acetylcholine levels in the brain and improve cognitive function. Rationale: acetylcholinesterase inhibitors such as donepezil help increase acetylcholine levels, improving cognitive function in Alzheimer's patients. 75. Which of the following is an early sign of Alzheimer's disease? A. Difficulty recognizing faces of loved ones. B. Severe confusion and agitation. C. Forgetfulness of recent events or appointments. D. Loss of the ability to walk. Answer: C. Forgetfulness of recent events or appointments. Rationale: in the early stages of Alzheimer's, patients commonly experience forgetfulness, particularly related to short-term memory. 76. A patient with Alzheimer's disease is showing signs of depression. Which of the following interventions would be most helpful? A. Ignore the symptoms, as they are a normal part of aging. B. Encourage the patient to participate in group therapy. C. Assess the patient's risk for suicide and provide appropriate interventions. D. Restrict social interactions to minimize emotional distress. Answer: C. Assess the patient's risk for suicide and provide appropriate interventions. Rationale: depression is common in Alzheimer's patients, and it is important to assess for suicidal ideation and provide appropriate interventions. 77. Which of the following is a common side effect of cholinesterase inhibitors used to treat Alzheimer's disease? A. Increased appetite. B. Hypotension. C. Nausea and diarrhea. D. Weight gain. Answer: C. Nausea and diarrhea. Rationale: nausea and diarrhea are common side effects of cholinesterase inhibitors due to their effect on acetylcholine levels in the digestive system. 78. A patient with Alzheimer's disease is unable to perform self-care tasks such as dressing and feeding. Which of the following is an appropriate nursing intervention? A. Perform the tasks for the patient without any input. B. Provide the patient with verbal instructions and allow them to attempt the task. C. Limit the patient's interaction with staff to prevent frustration. D. Encourage the patient to do everything independently. Answer: B. To provide the patient with verbal instructions and allow them to attempt the task. Rationale: providing verbal instructions and allowing the patient to attempt tasks promotes independence and maintains dignity while offering assistance. 79. A patient with Alzheimer's disease frequently becomes disoriented to time and place. Which of the following interventions is most appropriate? A. Provide the patient with a clock and calendar. B. Constantly remind the patient of the correct time and date. C. Limit the patient's contact with family members. D. Avoid correcting the patient to reduce frustration. Answer: A. Provide the patient with a clock and calendar. Rationale: providing a clock and calendar helps patients with Alzheimer's maintain orientation to time and place, reducing confusion. 80. A patient with Alzheimer's disease is often restless and has trouble sleeping at night. Which intervention would be most helpful in improving sleep? A. Encourage naps during the day. B. Provide a calm, quiet, and dimly lit environment in the evening. C. Keep the patient active during the night to promote sleep. D. Use medication to sedate the patient. Answer: B. To provide a calm, quiet, and dimly lit environment in the evening. Rationale: a calm, quiet, and dimly lit environment helps regulate the patient's sleep-wake cycle and can improve sleep quality in Alzheimer's patients. 81. Which of the following is the primary goal of pharmacologic treatment for Alzheimer's disease? A. To cure the disease. B. To halt the progression of dementia completely. C. To alleviate symptoms and improve quality of life. D. To restore lost memory function. Answer: C. To alleviate symptoms and improve quality of life. Rationale: the goal of pharmacologic treatment is to alleviate symptoms and improve the patient's quality of life by slowing the progression of cognitive decline. 82. Which of the following is the most common type of dementia associated with Alzheimer's disease? A. Vascular dementia. B. Lewy body dementia. C. Frontotemporal dementia. D. Alzheimer's disease. Answer: D. Alzheimer's disease. Rationale: Alzheimer's disease is the most common type of dementia, accounting for the majority of dementia cases in older adults. 83. Which of the following behaviors is most commonly associated with the late stage of Alzheimer's disease? A. Short-term memory loss. B. Loss of motor skills and physical function. C. Inability to recognize familiar faces. D. Difficulty with decision-making. Answer: B. Loss of motor skills and physical function. Rationale: in the late stages of Alzheimer's disease, patients experience significant loss of motor skills and physical function, often requiring total care. 84. A patient with Alzheimer's disease is refusing to eat. Which of the following actions should the nurse take first? A. Force the patient to eat. B. Offer the patient familiar, preferred foods. C. Tell the patient to eat in order to stay healthy. D. Withhold food until the patient becomes hungry. Answer: B. Offer the patient familiar, preferred foods. Rationale: offering familiar, preferred foods can help improve the patient's intake, as Alzheimer's patients may have difficulty with new or unfamiliar foods. 85. What is the purpose of using a structure routine for a patient with Alzheimer's disease? A. To reduce the patient's ability to make decisions. B. To maintain the patient's cognitive function. C. To reduce anxiety and confusion. D. To speed up the progression of the disease. Answer: C. To reduce anxiety and confusion. Rationale: a structure routine helps reduce anxiety and confusion by providing predictability and consistency in the patient's daily activities. 86. Which of the following is a hallmark pathological feature of Alzheimer's disease? A. Tau tangles. B. Increased dopamine activity. C. Reduced serotonin levels. D. Swollen neurons. Answer: A. Tau tangles. Rationale: tau tangles, along with amyloid plaques, are hallmark features of Alzheimer's disease, contributing to neuronal degeneration. 87. Which of the following signs and symptoms would a nurse expect to see in the early stage of Alzheimer's disease? A. Its inability to recognize familiar people. B. Severe personality changes. C. Difficulty remembering recent events. D. Complete loss of speech. Answer: C. Difficulty remembering recent events. Rationale: In the early stage, Alzheimer's patients primarily have difficulty remembering recent events and may forget appointments or newly learned information. 88. A nurse is caring for a patient with Alzheimer's disease who is exhibiting frequent mood swings. Which of the following interventions is most appropriate? A. Encourage the patient to express their emotions. B. Ignore the mood swings as part of the disease process. C. Use physical restraints to prevent agitation. D. Set strict limits on emotional expression. Answer. A. Encourage the patient to express their emotions. Rationale. Encouraging the patient to express emotions in a safe and supportive environment helps manage mood swings and provides emotional relief. 89. A patient with Alzheimer's disease is at risk for injury due to impaired judgment. Which of the following interventions is most important? A. Lock away all sharp objects and medications. B. Monitor the patient closely for signs of distress. C. Encourage independence in daily activities. D. Restrict all movement to prevent falls. Answer. A. Lock away all sharp objects and medications. Rationale. Due to impaired judgment, it is crucial to remove potential hazards, such as sharp objects and medications, to prevent accidental injury. 90. Which of the following is a key nursing intervention when providing care for a patient with Alzheimer's disease and agitation? A. Set firm limits on behavior. B. Provide a calm and quiet environment. C. Increase stimulation to distract the patient. D. Ignore the agitation and wait for it to pass. Answer. B. Provide a calm and quiet environment. Rationale. Creating a calm and quiet environment helps reduce agitation and anxiety in Alzheimer's patients who may be overwhelmed by overstimulation. 91. A family member of a patient with Alzheimer's disease expresses concern about their loved one's repetitive questioning. What is the best response by the nurse? A. This behavior is unusual and needs immediate attention. B. Repetitive questioning is common and often related to memory loss. C. Your loved one is being manipulative. D. You should tell them to stop asking questions. Answer. B. Repetitive questioning is common and often related to memory loss. Rationale. Repetitive questioning is a common symptom in Alzheimer's patients due to short-term memory loss. The nurse should provide reassurance and explain the behavior. 92. What is the most appropriate intervention for a patient with Alzheimer's disease who is unable to perform activities of daily living, ADLs? A. Allow the patient to do as much as possible independently. B. Provide assistance and encourage participation to maintain independence. C. Perform all activities for the patient without any input. D. Restrict the patient's movement to prevent accidents. Answer. B. Provide assistance and encourage participation to maintain independence. Rationale. Encouraging participation while providing assistance helps maintain the patient's dignity and independence in performing ADLs. 93. A nurse is caring for a patient with Alzheimer's disease who is demonstrating signs of aggression. Which of the following actions should the nurse take first? A. Physically restrain the patient. B. Speak to the patient in a calm and reassuring manner. C. Leave the room to avoid further escalation. D. Tell the patient to calm down. Answer. B. Speak to the patient in a calm and reassuring manner. Rationale. Speaking calmly and reassuringly helps to de-escalate aggression, reducing anxiety and the potential for further agitation in Alzheimer's patients. 94. Which of the following is a common behavioral symptom of Alzheimer's disease? A. Inability to recognize facial expressions. B. Aggression and irritability. C. Sudden onset of confusion. D. Increased energy levels. Answer. B. Aggression and irritability. Rationale. Aggression and irritability are common behavioral symptoms in Alzheimer's disease, often occurring due to confusion, disorientation, or frustration. 95. A patient with Alzheimer's disease has difficulty following instructions. Which of the following interventions would best support the patient's understanding? A. Use short, simple instructions with repetition. B. Provide lengthy and detailed explanations. C. Give multiple instructions at once to maximize understanding. D. Avoid any verbal communication to prevent frustration. Answer. A. Use short, simple instructions with repetition. Rationale: using short, simple instructions with repetition helps Alzheimer's patients better comprehend and retain information. 96. A patient with Alzheimer's disease is experiencing difficulty recognizing familiar faces. This is an example of which cognitive symptom? A. Agnosia. B. Aphasia. C. Apraxia. D. Anhedonia. Answer: A. Agnosia. Rationale: agnosia refers to the inability to recognize familiar objects or faces, which is common in Alzheimer's patients as the disease progresses. 97. Which of the following non-pharmacological interventions is most effective in managing behavioral symptoms in Alzheimer's patients? A. Regular exercise and physical activity. B. Restricting social interactions to reduce confusion. C. Avoiding all distractions and providing complete silence. D. Using distraction and redirection techniques when needed. Answer: D. Using distraction and redirection techniques when needed. Rationale: distraction and redirection are effective techniques for managing behavioral symptoms in Alzheimer's patients, especially when they become agitated or confused. 98. What is the primary purpose of using reality orientation in the care of a patient with Alzheimer's disease? A. To help the patient regain lost memories. B. To provide emotional comfort and reassurance. C. To help the patient recognize time, place, and person. D. To reduce the use of medications. Answer: C. To help the patient recognize time, place, and person. Rationale: reality orientation helps Alzheimer's patients remain aware of their surroundings, time, and identity, which can reduce confusion and anxiety. 99. Which of the following findings is characteristic of Alzheimer's disease in its later stages? A. Impaired short-term memory. B. Inability to recognize familiar people. C. Difficulty recalling recent events. D. Loss of motor coordination. Answer: B. Inability to recognize familiar people. Rationale: in the later stages of Alzheimer's, patients often lose the ability to recognize familiar people as memory and cognitive function decline significantly. 100. Which of the following would be most helpful in promoting safety for a patient with Alzheimer's disease who is prone to wandering? A. Use a wristband alarm or tracking device. B. Allow the patient to wander freely for exercise. C. Restrict the patient's movement entirely. D. Provide the patient with a map to find their way. Answer: A. Use a wristband alarm or tracking device. Rationale: a wristband alarm or tracking device can alert caregivers if the patient attempts to wander, improving safety without restricting movement completely. 101. A patient with Alzheimer's disease is frequently asking about their spouse, who has passed away. What is the best response by the nurse? A. Your spouse is fine. Don't worry about them. B. I know it's difficult, but your spouse has passed away. C. I will get you in touch with your spouse shortly. D. Let's talk about something else to distract you. Answer: B. I know it's difficult, but your spouse has passed away. Rationale: it's important to address the patient's concerns with honesty while being gentle. Acknowledging the reality helps the patient process their emotions. 102. What is the goal of using cognitive stimulation therapy in Alzheimer's patients? A. To reverse the effects of Alzheimer's disease. B. To improve memory and cognitive skills through structured activities. C. To increase the patient's physical mobility. D. To cure Alzheimer's disease. Answer: B. To improve memory and cognitive skills through structured activities. Rationale: cognitive stimulation therapy involves structured activities that stimulate mental function and improve cognitive skills, helping to slow cognitive decline in Alzheimer's patients. 103. A patient with Alzheimer's disease is becoming easily agitated during the evening. Which intervention is most helpful in managing these symptoms? A. Increase physical activity in the evening. B. Use medications to sedate the patient. C. Create a calm, familiar environment with dim lighting. D. Ignore the symptoms as they are part of the disease. Answer: C. Create a calm, familiar environment with dim lighting. Rationale: a calm, familiar environment with soft lighting can reduce agitation in the evening, a phenomenon known as sundowning. 104. What is the primary reason that Alzheimer's patients may become delusional or paranoid? A. Chemical imbalances in the brain. B. Lack of understanding of their environment. C. Memory deficits and confusion. D. Normal aging processes. Answer: C's memory deficits and confusion. Rationale: delusions and paranoia in Alzheimer's patients are often caused by confusion and memory deficits, which lead to misinterpretation of situations. 105. A nurse is caring for a patient with Alzheimer's disease who refuses to bathe. Which of the following interventions should the nurse try first? A. Perform the bath quickly to avoid further resistance. B. Leave the patient alone to prevent agitation. C. Offer a choice of bath time and allow the patient to have input. D. Ignore the patient's refusal and proceed with the bath. Answer: C. Offer a choice of bath time and allow the patient to have input. Rationale: offering the patient some control by giving them choices can reduce resistance and help them feel more comfortable with the activity. 106. Which of the following is a common pharmacologic treatment for Alzheimer's disease that works by increasing acetylcholine levels in the brain? A. Donepezil, Aricept. B. Memantine, Namenda. C. Lorazepam, Ativan. D. Sertraline, Zoloft. Answer: A. Donepezil, Aricept. Rationale: donepezil is an acetylcholinesterase inhibitor that increases acetylcholine levels, helping to improve cognitive function in Alzheimer's patients. 107. Which of the following is a key feature of Alzheimer's disease that differentiates it from normal aging? A. Significant memory loss that interferes with daily life. B. Occasional forgetfulness that does not disrupt daily activities. C. Physical changes in appearance. D. Mild forgetfulness that improves with rest. Answer: A. Significant memory loss that interferes with daily life. Rationale: Alzheimer's disease is characterized by significant memory loss that disrupts daily functioning, which is not typical in normal aging. 108. Which of the following signs is characteristic of moderate-stage Alzheimer's disease? A. Loss of the ability to recognize family members. B. Severe disorientation and confusion. C. Ability to communicate clearly and coherently. D. Complete independence in all activities. Answer: B. Severe disorientation and confusion. Rationale: in the moderate stage of Alzheimer's, patients experience severe disorientation, confusion, and difficulty recognizing people or places. 109. A nurse is educating the family of a patient with Alzheimer's disease about safety precautions. Which of the following should the nurse include? A. Remove sharp objects and hazardous materials. B. Encourage the patient to walk outside alone for exercise. C. Limit all social interactions to prevent confusion. D. Keep the patient's environment as unfamiliar as possible to stimulate the brain. Answer: A. Remove sharp objects and hazardous materials. Rationale: to ensure safety, it is important to remove hazardous items, such as sharp objects, that could pose a risk to the patient's well-being. 110. A nurse is caring for a patient with Alzheimer's disease who frequently gets lost in familiar places. Which intervention is most appropriate? A. Restrict the patient's ability to move around freely. B. Provide the patient with a GPS tracking device. C. Encourage the patient to roam freely to help with memory. D. Ignore the wandering behavior, as it is normal. Answer: B. Provide the patient with a GPS tracking device. Rationale: a GPS tracking device allows caregivers to monitor the patient's location and ensure their safety if they wander. 111. What is the main role of family caregivers for a patient with Alzheimer's disease? A. To ensure the patient does not go out without supervision. B. To provide emotional and physical support while encouraging independence. C. To monitor the patient's behavior and report it to a physician. D. To administer medication as prescribed by the doctor. Answer: B. To provide emotional and physical support while encouraging independence. Rationale: family caregivers are key in providing support while encouraging independence. Their role is also to ensure the patient's emotional well-being and assist with daily activities. 112. A patient with Alzheimer's disease is becoming agitated and combative during routine care. Which of the following interventions is most appropriate? A. Restrain the patient immediately to prevent harm. B. Use calm, reassuring language, and allow the patient time to respond. C. Tell the patient they must comply with the care. D. Leave the patient alone to prevent further agitation. Answer: B. Use calm, reassuring language, and allow the patient time to respond. Rationale: using calm and reassuring language helps de-escalate the situation. Giving the patient time to respond and allowing them to regain composure is often effective. 113. Which of the following statements about the progression of Alzheimer's disease is correct? H. Alzheimer's disease progresses slowly and stabilizes over time. B. Alzheimer's disease progresses in stages and cognitive abilities decline progressively. C. Symptoms of Alzheimer's disease can be cured with medication. D. Cognitive abilities may improve temporarily with treatment. Answer: B. Alzheimer's disease progresses in stages and cognitive abilities decline progressively. Rationale: Alzheimer's disease is progressive, with a steady decline in cognitive abilities. While treatments may slow progression, there is no cure or significant improvement. 114. A patient with Alzheimer's disease is having difficulty expressing themselves verbally. What type of communication would be most effective? A. Use complex sentences to stimulate thinking. B. Ask open-ended questions to promote conversation. C. Speak slowly and use simple, clear language. D. Avoid verbal communication, as it may frustrate the patient. Answer: C. Speak slowly and use simple, clear language. Rationale: Alzheimer's patients often struggle with speech. Using simple and clear language, along with speaking slowly, improves comprehension and reduces frustration. 115. Which of the following is the most appropriate approach for managing aggression in an Alzheimer's patient who is upset during personal care? A. Force the patient to comply with care. B. Attempt to understand the cause of the agitation and respond accordingly. C. Ignore the patient's behavior to avoid confrontation. D. Quickly complete the care task to minimize discomfort. Answer: B. Attempt to understand the cause of the agitation and respond accordingly. Rationale: identifying the cause of the agitation and addressing it in a compassionate and understanding manner is more effective than rushing or ignoring the behavior. 116. Which of the following symptoms would be most indicative of early-stage Alzheimer's disease? A. Inability to recognize family members. B. Difficulty remembering recent events or appointments. C. Severe disorientation to time and place. D. Loss of motor control. Answer: B. Difficulty remembering recent events or appointments. Rationale: in the early stage, Alzheimer's patients typically struggle with short-term memory, such as forgetting recent events or appointments. 117. A nurse is caring for a patient with Alzheimer's disease who frequently experiences periods of agitation in the evening. Which of the following interventions should be considered? A. Increase social interaction in the evening. B. Provide a calm and quiet environment during the evening. C. Encourage the patient to remain physically active throughout the evening. D. Use medications to sedate the patient at night. Answer: B. Provide a calm and quiet environment during the evening. Rationale: evening agitation, also known as sundowning, can be alleviated by creating a quiet, calming environment, reducing stimulation. 118. Which of the following non-pharmacological approaches may help reduce agitation in a patient with Alzheimer's disease? A. Physical restraints to control movement. B. Music therapy and sensory stimulation. C. Strictly limiting visitors to avoid overstimulation. D. Restricting the patient's access to familiar environments. Answer: B. Music therapy and sensory stimulation. Rationale: music therapy and sensory stimulation have been shown to improve mood and reduce agitation in Alzheimer's patients by promoting relaxation. 119. Which of the following is a hallmark characteristic of Alzheimer's disease? A. Decreased dopamine levels. B. The presence of neurofibrillary tangles and amyloid plaques. C's inability to form new memories due to hippocampal damage. D. Hyperactivity of the prefrontal cortex. Answer: B. The presence of neurofibrillary tangles and amyloid plaques. Rationale: Alzheimer's disease is characterized by the presence of amyloid plaques and tau tangles in the brain, which interfere with neuronal function and lead to cognitive decline. 120. Which of the following is the primary reason that acetylcholinesterase inhibitors are prescribed for Alzheimer's disease? A. To prevent the formation of amyloid plaques. B. To increase acetylcholine levels in the brain and improve memory and cognition. C. To reduce aggression and agitation. D. To increase serotonin production in the brain. Answer. B. To increase acetylcholine levels in the brain and improve memory and cognition. Rationale. Acetylcholinesterase inhibitors, such as donepezil, work by increasing acetylcholine levels in the brain, which helps to improve memory and cognitive function in Alzheimer's patients. 121. A nurse is educating the family of a patient with Alzheimer's disease about safety in the home. Which of the following should be a primary focus of safety interventions? A. Locking all windows and doors to prevent the patient from leaving. B. Removing tripping hazards and ensuring adequate lighting in hallways. C. Keeping the patient isolated in a single room to prevent wandering. D. Allowing the patient to roam freely to enhance their independence. Answer. B. Removing tripping hazards and ensuring adequate lighting in hallways. Rationale. Ensuring a safe environment by removing hazards and improving lighting reduces the risk of falls, a major concern for Alzheimer's patients. 122. Which of the following medications is commonly prescribed to manage symptoms of Alzheimer's disease? A. Amitriptyline Elavil. B. Memantine Namenda. C. Prednisone Deltasone. D. Lorazepam Ativan. Answer. B. Memantine Namenda. Rationale. Memantine is an NMDA receptor antagonist used to treat moderate to severe Alzheimer's disease by regulating glutamate activity and improving cognitive function. 123. A patient with Alzheimer's disease is becoming increasingly disoriented. Which of the following is the most appropriate nursing intervention? A. Tell the patient to focus and pay attention. B. Avoid correcting the patient, as this may cause frustration. C. Encourage the patient to engage in mentally stimulating activities. D. Ask the patient to recall specific details from the past. Answer. B. Avoid correcting the patient, as this may cause frustration. Rationale. Alzheimer's patients may become frustrated if their confusion is corrected. Avoiding correction and offering gentle reassurance helps reduce anxiety and agitation. 124. Which of the following behaviors is often seen in the middle stages of Alzheimer's disease? A. Loss of speech. B. Inability to recognize family members. C. Severe short-term memory loss and confusion. D. Complete independence in performing ADLs. Answer. C. Severe short-term memory loss and confusion. Rationale. In the middle stages of Alzheimer's, patients experience severe short-term memory loss and confusion, which significantly impair their ability to function independently. 125. A nurse is caring for a patient with Alzheimer's disease who is exhibiting wandering behavior. Which of the following is the best strategy to address this behavior? A. Allow the patient to wander freely to release energy. B. Secure doors and windows to prevent the patient from leaving the house. C. Restrict the patient to their bed to prevent wandering. D. Provide the patient with constant supervision, even when sleeping. Answer. B. Secure doors and windows to prevent the patient from leaving the house. Rationale. Securing doors and windows helps prevent wandering and ensures the patient's safety while maintaining as much independence as possible. 126. Which of the following interventions is most appropriate for a patient in the early stages of Alzheimer's disease who is still able to live at home? A. Provide 24-hour care in a skilled nursing facility. B. Encourage involvement in activities that stimulate cognitive function. C. Limit all social interactions to prevent confusion. D. Avoid discussing the disease with the patient to reduce anxiety. Answer. B. Encourage involvement in activities that stimulate cognitive function. Rationale. Stimulating cognitive activities can help maintain brain function and slow the progression of Alzheimer's in the early stages. 127. A patient with Alzheimer's disease is experiencing difficulty with daily activities, including dressing and grooming. What is the most appropriate action for the nurse to take? H. Perform these activities for the patient. B. Encourage the patient to complete these tasks independently, even if assistance is needed. C. Limit the patient's opportunities to engage in these tasks to avoid frustration. D. Ignore the patient's inability to perform these tasks. Answer. B. Encourage the patient to complete these tasks independently, even if assistance is needed. Rationale. Encouraging participation in daily tasks helps maintain independence and promotes dignity. Providing support as needed reduces frustration. 128. A patient with Alzheimer's disease frequently forgets to eat meals and becomes malnourished. Which intervention is most likely to improve the patient's nutritional status? A. Provide meals with a variety of textures and flavors. B. Encourage the patient to eat alone in a quiet space. C. Offer small, frequent meals that are easy to eat. D. Restrict fluid intake to prevent incontinence. Answer. C. Offer small, frequent meals that are easy to eat. Rationale. Small, frequent meals are easier to consume for Alzheimer's patients, especially those who forget to eat or have difficulty with larger meals. 129. Which of the following is a common early symptom of Alzheimer's disease? A. Loss of the ability to speak. B. Frequent episodes of forgetfulness and misplacing items. C. Significant changes in personality and behavior. D. Progressive difficulty walking. Answer. B. Frequent episodes of forgetfulness and misplacing items. Rationale. In the early stages of Alzheimer's, patients often experience forgetfulness, such as misplacing items, which affects daily functioning. 130. What is a potential risk of using antipsychotic medications in Alzheimer's patients? A. Increased risk of falls and fractures. B. Decreased appetite and weight loss. C. Improved cognitive function and memory. D. Rapid stabilization of symptoms. Answer. A. Increased risk of falls and fractures. Rationale. Antipsychotic medications can cause sedation, leading to increased risk of falls and fractures, particularly in older Alzheimer's patients. 131. Which of the following is an appropriate nursing intervention for an Alzheimer's patient who becomes disoriented during the night? A. Leave the lights off and let the patient rest. B. Encourage physical activity to tire the patient. C. Use soft lighting and provide reassurance. D. Give the patient medication to induce sleep. Answer. C. Use soft lighting and provide reassurance. Rationale. Soft lighting and reassurance help calm the patient and reduce disorientation, a common issue during the night in Alzheimer's patients. 132. A patient with Alzheimer's disease is experiencing visual hallucinations. Which intervention is most appropriate for the nurse? A. Argue with the patient to correct their beliefs. B. Agree with the hallucinations to avoid conflict. C. Gently distract the patient and redirect their attention. D. Ignore the hallucinations and continue with care. Answer. C. Gently distract the patient and redirect their attention. Rationale. Redirecting the patient's attention away from hallucinations is an effective strategy to manage such behaviors without causing distress. 133. What is the primary goal of using cholinesterase inhibitors in the treatment of Alzheimer's disease? A. To reverse the damage caused by amyloid plaques. B. To block neurotransmitters that cause confusion. C. To increase acetylcholine levels in the brain to improve cognition. D. To prevent the development of further dementia. Answer. C. To increase acetylcholine levels in the brain to improve cognition. Rationale. Cholinesterase inhibitors increase acetylcholine levels, which helps to improve cognitive function in Alzheimer's patients by enhancing neurotransmission. 134. Which of the following is an appropriate strategy to help an Alzheimer's patient with meal preparation? A. Let the patient prepare the meal independently, without assistance. B. Provide step-by-step guidance and supervision during meal preparation. C. Restrict the patient from the kitchen to avoid confusion. D. Give the patient the meal and allow them to eat without assistance. Answer. B. Provide step-by-step guidance and supervision during meal preparation. Rationale. Providing step-by-step guidance and supervision helps the patient maintain some level of independence while ensuring safety and proper nutrition. 135. What is the most effective way to support an Alzheimer's patient who is showing signs of depression? A. Ignore the symptoms as they are part of aging. B. Encourage the patient to engage in social activities and hobbies. C. Restrict social interactions to prevent confusion. D. Provide sedative medications to calm the patient. Answer. B. Encourage the patient to engage in social activities and hobbies. Rationale. Encouraging social interaction and hobbies can help alleviate symptoms of depression by providing mental stimulation and emotional support. 136. A nurse is providing education to a family caregiver of a patient with Alzheimer's disease. What should the nurse emphasize as a priority? A. The importance of minimizing the patient's social interactions. B. The need to maintain a structured routine and environment for the patient. C. The requirement to administer medication on time without any deviations. D. The necessity of allowing the patient to perform all tasks independently. Answer. B. The need to maintain a structured routine and environment for the patient. Rationale. Maintaining a structured routine and environment helps reduce confusion and anxiety in Alzheimer's patients, promoting safety and comfort. 137. What is the most common cause of death in patients with Alzheimer's disease? A. Respiratory failure. B. Cardiac arrhythmias. C. Complications related to immobility and infections. D. Stroke. Answer. C. Complications related to immobility and infections. Rationale. As Alzheimer's progresses, immobility and a weakened immune system increase the risk of infections, e.g., pneumonia, which are often the leading cause of death. 138. Which of the following is a common side effect of the medication memantine, Namenda, used in Alzheimer's disease? A. Insomnia. B. Drowsiness and fatigue. C. Gastrointestinal distress. D. Increased appetite. Answer. B. Drowsiness and fatigue. Rationale. Drowsiness and fatigue are common side effects of memantine, which is an NMDA receptor antagonist used to manage symptoms of moderate to severe Alzheimer's disease. 139. A nurse is caring for a patient with Alzheimer's disease who is experiencing difficulty following complex instructions. What is the best approach for the nurse? A. Provide instructions in a lengthy and detailed manner. B. Speak quickly to prevent the patient from becoming confused. C. Break tasks into simple, short steps and repeat as needed. D. Allow the patient to make decisions independently. Answer. C. Break tasks into simple, short steps and repeat as needed. Rationale. Breaking tasks into smaller, simpler steps with repetition helps Alzheimer's patients understand and follow instructions more effectively. 140. Which of the following is most likely to occur in the late stages of Alzheimer's disease? A. Improved memory and cognitive function. B. Inability to recognize familiar faces. C. Normal physical function and mobility. D. Severe improvement in emotional stability. Answer. B. Inability to recognize familiar faces. Rationale. In the late stages of Alzheimer's, cognitive decline is severe, often leading to an inability to recognize even close family members and friends. 141. A nurse is teaching a family caregiver about the importance of maintaining a patient's routine. What is the rationale behind this recommendation? A. It helps reduce feelings of isolation and loneliness. B. It provides a sense of security and reduces confusion. C. It helps prevent the patient from becoming physically dependent. D. It allows the patient to engage in meaningful activities throughout the day. Answer. B. It provides a sense of security and reduces confusion. Rationale. A consistent routine helps Alzheimer's patients feel secure and reduces disorientation, which is crucial for minimizing anxiety and agitation. 142. A patient with Alzheimer's disease is being started on donepezil, Aricept. What is the primary nursing consideration for this medication? A. Monitor for signs of hyperkalemia. B. Assess for gastrointestinal side effects such as nausea or diarrhea. C. Administer the medication only at night to reduce side effects. D. Discontinue the medication immediately if the patient becomes confused. Answer. B. Assess for gastrointestinal side effects such as nausea or diarrhea. Rationale. Donepezil can cause gastrointestinal side effects such as nausea and diarrhea, so these should be monitored closely during treatment. 143. Which of the following best describes the role of tau tangles in Alzheimer's disease? A. They increase the production of acetylcholine. B. They are abnormal protein accumulations that interfere with neuron communication. C. They prevent the formation of amyloid plaques. D. They protect neurons from degeneration. Answer: B. They are abnormal protein accumulations that interfere with neuron communication. Rationale: tau tangles are twisted protein fibers that disrupt communication between neurons and contribute to cognitive decline in Alzheimer's patients. 144. Which of the following interventions should be included in the care plan for an Alzheimer's patient with significant memory loss? A. Use complex strategies to help the patient recall memories. B. Provide memory aids such as calendars, lists, and visual reminders. C. Avoid discussing the patient's memory loss to reduce frustration. D. Increase the patient's activities to stimulate memory recall. Answer: B. Provide memory aids such as calendars, lists, and visual reminders. Rationale: memory aids help Alzheimer's patients with memory loss to remain oriented and improve their ability to function independently. 145. In patients with Alzheimer's disease, which of the following is a common behavioral symptom seen in the later stages of the disease? A. Increased impulsivity. B. Loss of bladder control. C. Difficulty with balance and coordination. D. Hyperactivity and restlessness. Answer: B. Loss of bladder control. Rationale: in the later stages of Alzheimer's, patients often lose the ability to control bladder function, requiring increased assistance with toileting. 146. When planning care for an Alzheimer's patient with communication difficulties, what strategy should be prioritized? A. Use only verbal communication, avoiding nonverbal cues. B. Speak slowly and use simple, clear language. C. Encourage the patient to express themselves freely, regardless of content. D. Speak loudly to ensure the patient can hear. Answer: B. Speak slowly and use simple, clear language. Rationale: clear, simple language and speaking slowly help Alzheimer's patients better understand communication, especially as their cognitive abilities decline. 147. Which of the following is an important consideration when providing education to the family of a patient with Alzheimer's disease? A. Teach the family to avoid asking the patient about their memory loss. B. Stress the importance of maintaining a high level of independence for the patient. C. Educate the family about the need for continuous and unchanging supervision. D. Help the family understand the progressive nature of the disease and plan for the future. Answer: D. Help the family understand the progressive nature of the disease and plan for the future. Rationale: it's important to help families understand the disease's progression and plan for future care needs, including potential legal and financial considerations. 148. A nurse is assessing a patient with Alzheimer's disease who is exhibiting new behaviors such as aggression and agitation.
What is the first step the nurse should take?
A. Increase the patient's medication dose. B. Explore potential environmental or situational triggers for the behavior. C. Isolate the patient to prevent harm to others. D. Encourage the patient to take a nap to calm down. Answer: B. Explore potential environmental or situational triggers for the behavior. Rationale: identifying triggers for aggression or agitation allows the nurse to address the root cause of the behavior and prevent further escalation. 149. Which of the following is an early indicator of Alzheimer's disease? A. Sudden severe memory loss. B. Difficulty remembering recent events or conversations. C. Increased physical weakness and tremors. D. Hallucinations and paranoia. Answer: B. Difficulty remembering recent events or conversations. Rationale: one of the earliest symptoms of Alzheimer's disease is difficulty with short-term memory, such as forgetting recent events or conversations. 150. Which of the following statements regarding the use of antipsychotics in Alzheimer's patients is true? A. Antipsychotics are the first line of treatment for Alzheimer's symptoms. B. Antipsychotic medications are typically used for short-term management of agitation or psychosis. C. Antipsychotics should be used regularly to prevent disease progression. D. Antipsychotics have no impact on cognitive decline in Alzheimer's disease. Answer: B. Antipsychotic medications are typically used for short-term management of agitation or psychosis. Rationale: Antipsychotics are used to manage behavioral symptoms like agitation or psychosis in Alzheimer's patients, but they should be prescribed cautiously due to potential side effects.